Chris Keller here again, Pinnacle Training Consulting System. So now we're going on to assessing movement. So one thing I want to say in this section is really important. I think it's important to look at all your clients statically, which means in place, which I am here, versus dynamically or movement, because statically can give a lot of information. So when I say statically, remember we said earlier, looking from the feet, position of the knees, position of the hips, position of the pelvis, position of the shoulders, position of the neck, and then side view, same thing coordinated. It gives a lot of information about what muscles are overactive and what muscles are underactive. So when we talked earlier about static movements, one of the things I like to do is a squat, 2 points of contact, and say to them, okay, I want you just to bend down, and come back up, and again, side view. So you're looking for foot alignment, knee alignment, hip, and some common things you'll typically see: knees going past toes, knees going towards midline, increase in lumbar flexion. All those dysfunctions are in your manual, and I think pretty much clearly laid out. Second, I like to use in-place lunge. In-place lunge, again, just tells a little about balance. Ask the client, okay, put your right foot forward, left foot back, heel up or down. This makes it a little more challenging. And it's going up and down, and then switching the opposite side. So again, the in-place lunge looks at quad control, looks at hamstring, glute control. It also looks at ankle and how much movement there is or not there is, and can they control it on the descending and on the ascending. Okay? Next I like to do is a forward traveling lunge. Is coming towards you, again towards you. Again, I'm watching pelvic control. Are they wiggling? Are their hips moving around? Also, their starting position. Is their pelvis or their femur rotated? Are they internal or are they starting like a duck? Because if they're starting like a duck, piriformis is going to be tight and weak. It's going to be shortened. And if they're internal rotated, you're not going to have contraction of the adductors, hip flexors. You already know one thing you can work on accordingly. Okay? Then I like diagonal. You've got your athletes, you've got people who play squash, sports like soccer, football. So diagonal forward, diagonal forward. Okay, so what I'm looking for when I'm doing this diagonal is how the knee is aligned with the foot. If they're going past their toe, you know that's probably an issue of control and proprioception. If they're doing this and they're wincing, it's either pain or they're guarding. Okay? If they're not being able to move up further, maybe there's a muscle length issue of the hamstring, hip flexor, or something that's restricting. And then lastly, what I'd like to do is reverse. So reverse lunge, and from the side view again, boring but effective, reverse lunge. Not necessarily how far they can go down to the ground, but can they extend their hip? Remember, if they're not extending their hip and they're stopping like this versus there, you know that the hip flexors are either tight, they have weak glute max, or there's a restriction in the hip joint. And again, through your functional assessment, coupled with this assessment, you get more information on what's going on. So I think from this point, what I'm explaining to you, look at what you need to use. Look how much time you have with your clients. Start with your squat. Starting with something like a single leg squat, is that practical? The answer is no, it's not practical, because who can stand on the leg and set down? It's very hard. From a balance perspective, you want to look at balance also from a two-point view, and then a narrow point base. If you have to and say, okay, I want you to stand on one leg, that's much harder to do than looking at balance with their feet close here, or changing their center of gravity. So think about your clientele like younger, older, senior, sport specific. If it's a issue of ankle stability or ankle control, you can also do hopping, and then you can do diagonal and vertical and how they land. Great functional test to see, can they stick it? When I say stick it, mean can they land on their heel and control without bringing the knee past their toe? Those are things you've seen in volleyball, in footy, rugby, and a lot of sports that require basketball control. And I would recommend you use these prime movement patterns, fundamental assessments, with all your clients that are specific on the ones that you need to work